us today. And how am I on sound for folks? Okay, I cannot tell, but I'll just keep talking. All right, good morning. Thank you for joining us today. We have a very exciting announcement to make, one that is important for public health, for environmental health, and for public safety. So how often can you find an issue that solves three problems as big as those with one very simple action? Very powerful, very exciting. I am joined here today with our champion, Supervisor and President of the Board of Supervisors, London Breed, and our Chief Pharmacist, Dave Woods, who has been also a champion with all of his colleagues as well. So we have a short program to just set the stage for what we're announcing. Then we will go over to the table to do some hands-on demonstration. And then if you'd like to see a kiosk in action, you can go into the pharmacy and see what it looks like when it's actually being used by people. So we all know that medicines are critical to our health. They help us heal from disease, from illness. We cannot live the quality of life and enjoy the quality of life we have today without medicines. But we also know that it's very rare, frankly, for you to finish every last pill in your pill bottle or every last ounce of liquid in your cough medicine. That our homes are full of unwanted and unused medicines. And many of us, especially here in San Francisco, where we're so trained to think about where does this go when I'm done with it, can be perplexed because we know it doesn't go in our blue or black or our green bins. So where are we supposed to put these medicines when we want to get them out of our homes? We also know that there's a tremendous cost associated with having those medicines accumulate in our homes. There's a cost to the sewage treatment plant when people flush their medicines down the toilet and they end up in our sewage sludge or going straight out into the bay and contaminating fish. There's a cost to children and to the elderly when they are accidentally taken or when they are not so accidentally taken and used inappropriately. And finally, there's a cost to society when they end up in the black bin, in our landfills, and contaminating water supplies. So as I said, this is a triple threat of public safety, environment, and public health, and we need a way forward. So I am proud today to announce the launch of a permanent citywide network of collection kiosks like the one here that are jointly funded, and they are funded by industry, by MedProject, and they are implemented by our pharmacists, by our police and sheriff's office, and by our hospitals and clinics. This is truly a shared responsibility model, and I'm grateful for the participation of all the parties in making this happen. San Francisco now has 32 locations where these kiosks are present. They're in our neighborhood pharmacies, like the Greenhouse Pharmacy in Richmond. They're in the Mission Wellness Pharmacy. 3 Kaisers have them in it. All 3 Kaisers have these kiosks. And our city clinics, whether it's here in San Francisco General or in our community clinics as well. So it takes all of us participating to make sure that we keep these unwanted medicines in the right place, safe disposal. Save a life, protect the environment with a very simple action. Now, we're here today not because it was easy, but because it actually took a lot of leaders pushing in the same direction to get this shared responsibility model off the ground. And it could not have happened, it would not have happened without the tremendous support and leadership of Supervisor London Breed. I watched her firsthand bring together somewhat unwilling parties, I may say. Parties from industry, parties from civil society and from government. All of us, as well as the retail community, needed to be brought together in a way where we could find a path forward. And it was her tenacity and her commitment and her creativity that enabled this program to launch. I have to say that we weren't the first, that Alameda County led the way, and it was Supervisor Breed who took that kernel of an idea from Alameda County, shaped it, formed it, and made it so powerful here that we're celebrating today in San Francisco. So with that, let's welcome Supervisor and President London Breed.
Good morning, everyone. I am so thrilled to be celebrating the launch of this program to make it permanent. And today we're making it easier for San Franciscans to dispose of their unused and unwanted medicines. I personally am so excited because District 5 in particular, we have 6 locations. Wow. In my legislation, we're requiring 5 in each supervisorial district. And so some of the other districts have a lot to catch up with. But I go to Charlie's on Fillmore and Golden Gate, and I'm always excited to go there because this particular pharmacy like Charlie's can do something like this, then it could be done anywhere. So I just wanted to make that point. And so now here at San Francisco General, this is a great moment. And I will say that even though Alameda County was able to pass this particular program, former Supervisor David Chu started down this path at the Board of Supervisors, and then when he went to the Assembly, he basically said, could you take this on? And I'm like, of course, it wasn't even a question. And so I just want to thank Assemblymember David Chu for his leadership in moving this forward. And it wasn't easy, bringing the pharmaceutical companies to the table, the San Francisco Chamber, stakeholders, business community, the hospitals. It was some interesting conversations, needless to say, but ultimately to do exactly what we've been able to do here in San Francisco so that we can make sure that we're keeping people safe. And this is a public safety issue, to make sure that, as Debbie said, these pharmaceuticals are not flushed down the toilet and end up in the bay. Just look at the bay, the water in San Francisco Bay, and the impacts is not, I know, just from pharmaceuticals, but from so many things that we've done, so much toxicity, so much waste, and we have to do a better job. We have to be stewards of the environment. It's why I push for this legislation. It's why I continue to push for smart environmental legislation, because we have a lot of catching up to do. And so this pilot program has kept 44 tons of unused medicine out of the landfill, out of the bay. That's the equivalent of 9 elephants. Just imagine 9 elephants of pharmaceuticals walking around that could have been in a place that they shouldn't be in, and what a difference that's going to make for our environment and for future generations. And this is the great thing about this program. While the industry, the pharmaceutical industry, may have come kicking and screaming, they're at the table and they're helping to pay for these programs, and I appreciate it. Even though they may not have always agreed with us, we found a great partner in the MED Project and the pharmaceutical industry stewardship organizations, and I just want to thank them for their partnership in working with us to try and do exactly what we need to do. They produce the medicines, and so it's only right that they take responsibility for taking them back when they're not necessarily used. And so I just want to thank them, thank the Department of Public Health, the Public Utilities Commission, and all the advocates and organizations who worked with my office to make this possible. It just feels really good. Sometimes we pass legislation as policymakers and we don't see the impacts of that legislation. And so we're seeing this legislation at work because places like Kaiser and Walgreens and other places that sell pharmaceuticals all over the city, they have kiosks now. They're making it easier for their customers to return unwanted unused medicines. And then we as a city, we're setting an example by making sure that the hospitals and the places that we oversee have these locations. So I'm really excited about that. And I want to just say to members of the public or to, just spread the word about making sure that you take that trip and you keep your little baggie with your unused or expired medicines and make it into, like I make it into an event when I go to Charlie's, because I run into everybody and everyone wants to talk to me. And so I think, okay, I'm ready to go to Charlie's to have the conversations with the community. So I take my bag of unused, expired and unwanted medications, and it becomes an event. And just imagine what a difference that makes if we all did that with our unused and expired medicines. So I just want to thank again the Department of Environment and so many people who have made this possible. Let's get the word out there, and let's make sure we do our small part in protecting the environment. Thank you all so much.
We are so lucky to have that kind of leadership and sophistication at bringing parties together to find a path forward. We are very lucky to have that leadership here in San Francisco. We're also lucky to have fellow city departments that really get it and are true partners with the Department of Environment. And I want to give an especial shout out of gratitude to the San Francisco Department of Public Health that has been with us every step of the way, because they understand the importance of these kind of programs and they want to see them work. Now, you may not know this, but October is a very auspicious month. It turns out it is National Pharmacist Month. So if you were wondering about your Halloween costumes, I think we can all get our white coats and talk about safe medicine disposal while we trick or treat. But the pharmacists, when they're not wearing their white coats, they are charged with taking care of our city and making sure that people have the right medicine at the right time, and then ultimately that we are protected from being exposed to medicines inadvertently. And so we cannot have a program like this without the full participation and support of our pharmacists. San Francisco is also lucky because we have a chief pharmacist who gets this responsibility in his very core. Dave Woods is here to talk about his perspective on this issue, share with you his support. So let's show him our gratitude for all the work that the pharmacists do in our city every day.
Thank you, Debbie, and happy Pharmacist Week, National Pharmacist Month to you all. I'm really pleased to be here on behalf of the Department of Public Health. The department has been a proud supporter of this initiative and the ordinance from the very beginning, and we really welcome the launch of this new program, which, as stated earlier, is industry-sponsored and paid for, which is a wonderful new thing to do. At the national level, prescription drug abuse and misuse is at a crisis level. Here's some data from the epidemic, which is sobering. More drug overdoses occur annually from prescription medicines than from heroin and cocaine combined. From the Center of Disease Control, 60,000 children in the United States are hospitalized every year because of accidental medicine poisoning. There are over 1,000 emergency department visits daily in the U.S. from prescription opioid misuse. 2/3 of non-medical prescription opioid users obtain prescription opioid from a family member or friend, given to them for free, stolen, or bought. There are over 1.9 million persons in the United States with opioid use disorder related to prescriptions. Locally, the storage and disposal of unwanted meds is an issue. It impacts us all, and we hear it on a daily basis. People who are ruined by prescription drug issues. As stated earlier, almost 2/3 of persons in San Francisco were given a prescription for a medicine, and it's in their medicine cabinet right now. It's just waiting to be disposed of, even though that they're no longer using it. Unfortunately, these leftover medications can lead to misuse, abuse, accidental poisonings of pets, children, and people we love. We see the impact here in the emergency department at Zuckerberg San Francisco General. We see it on the community streets here in San Francisco and wherever we go. We see it in our jails, and unfortunately we see it in the morgue too frequently. There clearly is a need for safe medication disposal, and this project allows that to happen. Pharmacists play a very important role in this process, and I'm so pleased to be able to say that our 2 city-owned and operated pharmacies now have these kiosks. One is here at Zuckerberg San Francisco General in the outpatient lobby, and the other one is with Community Behavioral Health Services in their Howard Street pharmacy. Pharmacists have long received requests from patients and others in the community to take back their medicines. We now have an opportunity throughout San Francisco for that to happen. Our pharmacies here fill over 60,000 prescriptions a year for 15,000 patients and clients. We welcome those people to come and use it, as well as any other persons from the community who are interested to use our kiosks. And as the city's public health agency, we're happy to be the leader in this, and we really promote the use in other pharmacies throughout the city so that we can make this, any patient can go to their pharmacy and dispose of unwanted medications. Thank you.
Okay, I want to just do some quick call outs and thank yous for this event before we go over to the demonstration. I'm completely indebted to Supervisor Breed and her staff for what they have done. I'm indebted to Nate Miley and for everything he has done as supervisor in Alameda County, for Assemblymember Chu and his leadership. These are our elected officials who, without their courage, we would not be where we are today. We've got an opportunity to send this message loud and clear to the state of California. We've got jurisdictions across the state who are taking this on. It's time for the state of California to step up as well. I want to also thank the NGOs and my fellow city departments. The Public Utilities Commission and the Wastewater Division is incredible champions of this issue. We've got Heidi Sanborn here from the California Product Stewardship Council, and she has been leading the charge throughout California. So there's tremendous leadership in this space today. So with that, I would just like to end. We have 32 kiosks, 32 locations. If you're wondering where they are, go to our website, sfenvironment.org, and if you can do /medicine/meds, or just go to the home page and you'll say, where do I put something? And you can find out where those locations are. We have a map that you could take a picture of if you're here today, if you're curious. There's also other locations in the city that are not part of this program that also you can take back medicines to. So there's lots and lots of opportunity. It's convenient, it's easy, and it is an imperative. So with that, I would like to invite my colleagues up here to come over, and we will show you how easy this really is to do. Okay. So,
So we're acting out here.
So you're at Charlie's.
Hey, Mr. Woods, good to see you again. Well, I came to drop off my medicines, and I think I got some Skittles mixed up in there, too. Is that okay? Oh, sure. So where's my key? Oh, there's my box over here. I'm going to step over here without the microphone. Oh, I'm like, where is it? And then we're going to just take it, open it up, pop it in there, bam. So simple. So simple. And even if you had because I actually don't put them in a Ziploc. I just take the whole box and all this stuff, and I have usually in a paper bag because I don't use a lot of plastic. Take it. Easy. Easy. Real easy. Do you want me to do everything?
Well, I'd like you to just point out what's a good idea to do.
Oh, so for privacy, I recommend just pulling off the labels because that's what I do and tear them up. But just mark them off so that your private information isn't on there. That's a really great idea. And again, you can also pour the pills into a Ziploc or another bag to put them in there. And these can be recycled in the regular recycle without the pills. So we want to get to zero waste, so we're not messing around with anything. All right.
And the one thing, thank you, Supervisor, that was very clear how easy it is to do. There's one item that really can't go in there, and those are needles, things that are sharp. All right, and so San Francisco has an alternative method for people to get rid of their needles. If they are diabetic and they have a lot of needles to get rid of, they are these red containers, these sharps containers. You can get them at any Walgreens. You can get them at all the participating pharmacies. They will give them out. You'll give them your full one back, and they will give you an empty one. So it's really important that people understand that those kiosks can take liquid, they can take pills, they can take creams. The one thing they cannot take is sharp, pointy objects. So the sharps and the needles have their own special container, these red ones here.
And then can you talk about the bag?
Ah, yeah. So if you don't have now, Supervisor Breed said she has how many in your district?
6 locations.
6 locations in her district. If you are in a district of San Francisco where you are not so lucky to have 6, you can also put your medicines in these mail bags, put them in the mail, and it's all postage paid. To get one of these mail back envelopes, Maggie, where do you get them? Sorry, what?
You can get them at various locations, primarily San Francisco Public Libraries, although not all public libraries. And you can also contact the Med Project, and they will mail you an envelope at your home.
So we are trying to make this as easy as possible. For elderly people that have a hard time getting out and getting to the pharmacy, they can contact Med Project, and Med Project will mail them a mailer. They can then put their medicines in the mail, and it goes from there. So I think what we have demonstrated physically and verbally is that this is easy, it's convenient, and as Dave Wood said, it's critically important. The statistics are there, they're very disturbing. We must get these materials out of our homes, safely dispose of them. It's a matter of life and death and health. Thank you.